All right, most appropriate initial pharmacologic intervention for this patient. Nitric oxide still down the fill. Does this guy have like ED? No, it's a female. 35-year-old female. Presents with 6 months history of progressive dyspnea on exertion and fatigue. No chest pain, fever, or cough. Blood pressure, normal. Heart rate, normal, maybe a little tachycardic. O2 stat, normal. Cardiac auscultation reveals a loud P2 and an early systolic murmur. ECG shows right axis deviation and right ventricular hypertrophy. Echo reveals elevated or estimated right ventricular systolic pressure of 50. Most appropriate initial pharmacologic treatment. So she has, idiopathic pulmonary hypertension, which is due to like increased, pulmonary vascular resistance, right?
Mm-hmm.
Um, so something that decreases the pulmonary resistance, would be a correct answer. I mean, I don't know exactly what the best answer would be. I mean, I'll get rid of sildenafil that's used for ED. Um, Yeah, like you can use nitric oxide. It would cause vascular dilation. Epoprostenol, is that like a prostaglandin? I mean, I don't think that would be appropriate. Um, Inhaled beta agonists, no, that's for asthma. Oral calcium channel blockers. Yeah, I think I mean, it's not really out of I can't rule that out, really.
Okay.
And I'm like trying to look at her like blood pressure and like heart rate and see if that's like fine.
So you got the diagnosis correct, I would say. Kind of where do you want to go from here?
I feel like inhaled nitric oxide that has a really short mechanism of action though, right?
Mm-hmm. It's really
Right.
short.
Yeah, so I think I'll go with the calcium channel blocker.
Pretty sure it's sildenafil. Okay, yeah. So this is actually kind of interesting. So the one that we always learn about is that what is that called? You remember the drug that you usually use for primary what is it called? It was in step one, pulmonary arterial hypertension. I can't remember what it's called, but it has an EN in it, some endothelial thing, right? But they don't give you that answer choice here. So sildenafil actually was created originally for blood pressure, if you remember. But I think sildenafil actually works really well for PAH. I don't exactly remember why. I just remember that it does help kind of that vascular system on, especially on the pulmonary side. We don't usually use it for, primary hypertension because there's so many better drugs like the lisinopril and things like that. But definitely just remember that oral sildenafil will help with PAH. It's one of the things that they always make you memorize for some reason. But I'm trying to remember what's the other drug for. Let me see.
I'm looking it up too.
Another drug used in
Oh wait, it says you can use epoprostenol too. It says
yeah. Which one's first line though? Which one's yeah, bosentan, right? Is another drug, endothelian antagonist. That's what let me see what else you can use. Does it say what is the initial therapy that you can use by any chance? I know like these guidelines change quite a bit.
I mean
But
I'm just looking at ChatGPT, but it's like four different drugs you can use.
yeah, I think this one's tough, but I would say that bosentan is probably the one that if they're going to get tested on, is probably bosentan. That's the one they always ask on. And for some reason, I do remember sildenafil as being kind of like this, like another option you can use. Of course, it seems like there's multiple options that you can use, but just keep it in the back of your mind because they do ask these questions because it's a rare disease, but bosentan is asked pretty frequently. So.